Hello. Hello, welcome to Askawayhealth Live. Good afternoon, happy Sunday, wherever you are. Thank you for joining me this afternoon. Good to see you remotely. Wow. So guys, I'm your hostess. My name is Dr. Sylvia, a general practitioner and health educator with Askawayhealth. I have a special interest in women's health and sexual and reproductive health, amongst other things that we do in general practice. And if this is the first time you're coming across the channel, I'm so pleased to have you here. On Askawayhealth, we have videos that look at trending health, medical wellness issues, lifestyle topics to educate and help us create a discussion that can get us more out of life than what we have, keep us healthy and really being positive about things. We publish a new video once a week, every Thursdays usually, and then we have these live streams on Sunday afternoons, where it's just an opportunity for me to have a chat about some relevant topic of the moment, something that perhaps a patient has discussed with me during the week, or something that I've noticed lots of people making plenty of comments about. And yeah, they tend to be quite interesting. So I hope that you can make it a date when you can. You can find us on social media on Askawayhealth. So please check out the links in the description box for this video, and our website askawayhealth.org is another place you can find us, and here on our YouTube channel. So do please take a moment after the stream, before you go away, to like and consider subscribing to the channel. That would be great if you haven't done so already. So let's make a move. Oh, I will just have a quick look and say hi. Yeah, I've got a couple of people on the chat. Nice to have you guys on board. Thank you so much for joining. Leave me a comment, please. But let's get cracking. Let's get into today's topic. So we started the series, pregnancy stories series. Oh, mouthful. We started this last week, and then I gave you a bit of a background about why I thought this was an interesting health area to discuss. Someone raised a discussion on Twitter with a thread that went really viral. Last time I checked, it had over 10,000 likes. I think it's probably gone up by now, because there was so much discussion and emotion around the topic. And it had to do with a lady sharing her experience about possible complications that could develop during childbirth and after, during pregnancy, childbirth, and after. And the theme was, well, they didn't really tell me about this. They didn't really tell me what to expect. And lots of people came on board and had this same experience, that there have been complications like postnatal depression, problems with breastfeeding, other different issues that arise around pregnancy and childbirth, which they felt they didn't have enough support. And it's quite an emotional issue, quite important. And I thought it was really good for us to look at some of the topics that came up. Of course, a few users also shared their own positive experiences. Some women have very smooth pregnancies without any complication, but that's not the same for for other women. And it's always good to have a balance. And I thought this was a good opportunity to discuss this issue. Last week, we talked about breast issues. We looked about breastfeeding, the common problems that could arise from with the breasts when you're pregnant, the common complications you may experience, and issues that you could develop afterwards. So not just with breastfeeding, but infections like mastitis or breast engorgement and so on. So if that is something that applies, or something that you relate with, or you want to get more information about, please make sure you check it out. I'll put the link for that video. It was just last week, but I'll put the link in the description box here as well. This week, we're talking about cuts and tears. And by that, I mean cuts to the perineum. That's the area where the vagina is located, with the anus down below, and the opening for the bladder above. But that space where that could sustain cuts and tears around or during childbirth. So I want us to have a discussion about this because it also created a ton of discussion on this same thread. So I think we're going to be looking at, and hopefully we have enough time, so I'm going to be going pretty quickly, but please ask your question in the chat, drop a comment. I know lots of doctors, nurses, and non-medics watch the stream and listen to my videos. And please share your experience, what you'd hope as a medical person that you would like your patients to know. And as if you're, somebody who is not medic, but you've had a baby or you're pregnant and expecting soon, share your experience, ask your questions. That would be lovely to get that interaction with you. So we're going to be looking at the difference between a tear, a vaginal tear or perineal tear, and an episiotomy or cut, why they happen. In other words, what makes them likely to happen? What are the complications or the problems that can develop after somebody has a tear or an episiotomy or a cut? What are the treatments? How do you get back to normal? How do you get better? And we're also going to look at possible tips to prevent. So let's get into it, starting with a tear. Now, a tear, around that area I've described to you, and I'm so sorry I haven't got any pictures. I am hoping that in the next couple of weeks, we are going to be improving our streams and hopefully be able to get access to software that would allow me to put pictures on, because it's really good to get pictures and you get a visual of what we're talking about. But tear is an injury sustained to the vagina and nearby tissues during labor or childbirth. Now, there are different grades of tears depending on the extent of injury. We're going to be talking about them, but you may have heard about first degree or second degree or third and fourth degree tears. Now, these are quite different from episiotomy, as we're going to see shortly, because episiotomy is an intentional wound or cut that's delivered to that area. Okay, so if we start with first degree tears, now you're going to excuse me again, like I said, I've already apologized for not having any visuals, but I'd like to introduce you to some of my daughter's playthings. I didn't tell her before I brought this up, but I wanted to use them to make this demonstration. So if you want to imagine that this is the vaginal opening, as a lady is ladies in very advanced stages of labor and the baby's head is coming through. So what you expect is an opening, a space that's nicely widened, of which the vagina usually is an elastic canal, and is able to stretch to accommodate the head of the baby. So what you expect is nice movement with the help of the contractions that the mom has, mom's pushing effort, and the fact that the baby's head, even though it's a skull with bones, the bones are still quite soft and malleable. So as they go through that sort of canal, with all the activity, baby's head is able to come out nicely, and here's cute little that's helping us to demonstrate how how easily this happens, how smoothly it happens. And I'm going to show you some instances or discuss some instances where it doesn't happen as smoothly as this, and so there is some kind of injury that could happen to the tissues, to the vagina itself, the canal itself, or the tissues around. So let's put my cute little baby helper here. So back to first degree tears, that they could happen anywhere around the lips, or what we call the labia, the clitoris, or even inside the vagina. Now, these tears could be referred to as lacerations, so simple little cuts, or even just abrasions or scratches, or actual tearing. But the thing about first degree tears is that they heal very quickly, usually don't need treatment. They're unlikely to cause long-term problems, but they can be sore. So there's that discomfort that some women who sustain this kind of injury might experience, but then it settles with time and pain relief, and the tissues heal as you progress from childbirth. The second degree tears. Now, these are tears, so we're going to be advancing upwards now. These are tears that affect the muscle. Remember the first, we're just talking about the surface skin, or in some cases within the vagina, to a little degree. But now with second degree tears, you're looking at those that affect the muscles of the perineum, that space where the vagina is located, and the skin. They would usually require stitches, but those stitches are fairly straightforward, and the repair is normally done using local anesthetic, can be done right in the labor room where you had the baby. Now, they can cause problems. They're not as severe as some that we're going to talk about next, but they can sometimes cause problems and can cause a lot of soreness as well. So third or fourth degree tears. Now, these are the more severe types of tear, because for some women, the tear might go deeper And for example, if if we use my friend here, if we imagine that this is where the anus is located underneath, if the tear is deeper and extends into the muscle that controls the anus going down, it can cause damage to the muscle we call the anal sphincter that controls how the anus opens. And it's usually a more serious type of tear that can leave severe medical problems. Now, this kind of injury, you would have to be taken to the operating theatre. So this is a more serious one. You might need to be put under some form of spinal or epidural anesthesia so that your doctors can get a really good look and repair it adequately. Now, you might need to have an infusion, an IV infusion, or have a catheter, which is a tube that goes into the bladder. You might need antibiotic treatment and, of course, painkillers in terms of managing. So third or fourth degree tears are they're quite serious. Okay, so it's really important to get all that out of the way. But let's just talk a little bit more about these tears. They're quite common. Generally, tears to the perineal tears affect 80%, up to 80% of women during childbirth. So they're quite common. Also, first-time moms are more affected overall. So a first-time mom compared to one who's had children before, gone through labor and childbirth before via the vaginal method, a first-time mom is more likely to experience a tear. Now, in terms of how frequently it happens, for second-degree tears, that involves the vagina, not the first-degree sort of minor or less serious ones. Second-degree tears tend to be up to sometimes 70%, 75% in women delivering for the first time, and about 35-40% in women who have had pregnancy or who've been pregnant before and delivered before. For the other more serious third and fourth degree tears, they can occur in 6 out of 100 births. So 6 out of every 100 births in first-time moms. So that's for the third, fourth degree tears. While if a woman has had kids before, delivered vaginally before, the frequency of having those severe kinds of tears reduces to 2 out of 100 births. So that's 2%. So that's looking at how common. So this is an issue if you're getting something that could potentially affect or that can affect 80% of women during their childbirth. Okay. The other thing that's important about it, and I've said we're going to look at complications, but we can start now, is the third and fourth degree tears where you have damage to that muscle in the anal sphincter I was talking about. These are the largest risk factors in obstetrics for developing anal incontinence. Anal incontinence is a situation where a woman loses control of her bladder, she said, of the anus, I beg your pardon. And she's no longer able to control the anus, so she would soil herself. She could leak feces, release gas or fart without any control, without any warning. So you imagine just how that could impact on an individual. So having a third or fourth degree tears, that's why we take them seriously. They're treated, they're repaired in the operating theatre. So you're looking very, very carefully at what you're doing and managing them properly. I did say second degree tears, while they're less serious, they're cold. And this is from a recent study carried out in Sweden, looking at following up a group of women who'd had their babies some years ago and looking at the impact of the types of tears that they sustained during childbirth. And he mentioned that just having a second degree tear alone could lead to problems with the sexual health or sexual life of these women, simply because they developed the tears. Okay, so let's look at what conditions make tears likely. I'm just going to have a quick look and make sure I'm not missing any. Like I said, I would love to hear from you guys. So make sure you leave a comment, ask a question. This is a topic that I think lots of us can contribute to. So if there's something that's particularly burning, shout out. So it's, like I said, it's more common in first-time moms, but the third or fourth degree tears could happen. And again, this is looking at this Swedish study. I'll put the link to that in my description, just published last year. The third or fourth degree tears are more likely to happen if the natural birth is assisted with vacuum extraction. So the vacuum method is where babies coming through, but for some reason or the other, the progress is not so smooth or is taking some time, and so a vacuum suction cup is inserted through the vagina onto the baby's head to gently withdraw the baby for assisting labor, assisting delivery. And doing this is one of the conditions that could make a tear more likely. Another one is having a baby whose weight is more than 4 kilograms. Another one is a baby whose head circumference, and I bring my cute little helper baby again. So if baby's head circumference is bigger, wider than the vaginal opening, then of course you can imagine how that could lead to possible tear. So these are some of the issues or some of the conditions that could make having a tear more likely. So if the tear has happened and either it's been repaired in the operating theatre, or it was a sort of less serious one and repaired in the labor room, what do you do? What should you do? What are the things that you must pay attention to afterward? Good hygiene is essential. We recommend that women use only water in this initial period, the first few days. Use water to keep the area clean. Important to wash or shower at least once a day, and make sure the sanitary pads are being changed regularly during the day. So it's not just leaving one pad on for 6 hours or whatever. Please make sure they're changed, because it's easy to pick up an infection in that area. And so keeping the area clean and fresh, particularly while you're still losing lochia, the blood from your post delivery status, is important, because if that blood is allowed to collect in your genital area, that provides a beautiful culture, beautiful environment for germs to grow. Okay, also wash your hands before and after going to the toilet or changing your sanitary pads. Be very, very strict with hygiene. These will help you to reduce the chance of infection developing in your stitches. And by the way, usually the stitches that are used are soluble, they're dissolvable stitches. So there's nothing, most of the time these days they're dissolvable, and so they would, as your tissues heal, the stitches will dissolve. But the important thing is, during that time while your tissues are healing, is making sure that infection does not develop. What are the signs of infection? How do you know that something is not right? If the skin or the area starts to appear or feel quite swollen or looks very red, particularly around the stitches, and if you start to get a discharge or pus coming from the wound, if you notice that, yes, you will be in pain, that is given, but manage with painkillers. But if the pain becomes quite severe, undue severity, really uncomfortable, tenderness at the wound, and then you perceive an odor that doesn't appear normal, not the odor of bleeding from the lochia, but it's an offensive odor or odor that doesn't appear normal, or developing a high temperature, all these could suggest that there's an infection going on, and you should please seek quick, urgent medical assistance, so that particularly if it was a second-degree tear where you may not have been started on antibiotics, then it's important to get through to get the right treatment before things get any worse. Big challenges after tears and even cuts is using the toilet, particularly. So if you've had a repair, if you've had stitches, you can expect the soreness to continue for 2, sometimes 3 weeks, especially, of course, think about it as you sit down. You can expect that to happen. The stitches can be irritating when they are healing. So those stitches that I said that we use, mostly dissolvable ones, they can be irritating when healing, but this is mostly normal. It's part of the healing process. If it's severe, then you should be speaking to your doctor or your midwife or the nurse. Women could experience stinging when they're passing urine, and the best way to look after this is, when passing urine, have a bottle or container that you can use to pour lukewarm water, so body temperature, skin temperature water, over your genitals as you're passing urine, just to relieve the discomfort. The discomfort will settle, but these are some of the tricks that some people share, helps to get through the discomfort. Avoid constipation. Really important to avoid. What we do is ensure that after, particularly if a woman has had surgery or she's had a repair done in the theatre, Or in any case, it's make sure that you don't get constipated. So she's either giving laxatives and the advice to drink plenty of fluids and lots of roughage, fiber, vegetables, and things like that in your diet to make sure stools are nice and soft and you're not straining in that area. Another trick that some women share is when you're sitting on the toilet, you can get a little stool and place your feet on the stool, which just helps to move your bowels into position that is easier for the feces to leave your body. But I think the key thing is don't rush. Don't rush. Don't try and force yourself to stool. If you're eating right and you're on laxatives, your stool hopefully will be nice and soft and things just come away simply and easily without putting any pressure on the stitches. Also, pelvic floor exercises help. I've got a segment in the stream where I talk about pelvic floor exercises, and you may know them already. Pelvic floor is that area where the vagina, the bladder opening, and the anus are located. And if you want to know what your pelvic floor muscles are, just imagine that you are sitting on the toilet trying to pass urine, and I ask you stop passing urine, and you squeeze. Those are your pelvic floor muscles, and those are the muscles that you exercise, but we'll talk about that. So usually third, fourth degrees heal very well in most women, really very well. But like I said, it is one of the risk factors for some women, a small group of women, to develop anal incontinence, which I've already discussed. And if this does happen, please don't be embarrassed. These can be treated. It's important to seek medical help as soon as you feel that you're losing control of the bowel, and your doctor can look into it for you. Okay, what about activities? So how soon can I get back into doing things? Let's grab a sip of water. This talking can cause a lot of parchness in the throat. So if you're recovering after having had a tear, what kind of activities? How soon can you get back into things? Well, listen, everybody's experience is going to be different. And so what you think is normal activity could be different for me and different for you. But generally, we say that for 4 to 6 weeks, avoid any strain or pressure on the anus. Avoid high impact exercise or lifting heavy weights. And after that period when your tissues are sort of in advanced stage of healing or probably nearly healed, you can then gradually increase your general activity. But it's always important to be sure, don't rush. There's no need to rush things. If you're not certain that things are not right, if you're not certain whether or not things are back to normal, you can always ask your nurse or midwife, doctor to have a look. Obviously, as you feel better, as the pain settles, the bleeding settles, then you can tell that things are probably getting back to normal. But with any concerns or uncertainty, speak to one of us. So looking after a newborn baby and recovering from a tear, particularly a severe tear, can be difficult, can be hard. So if you get support from friends and family, take it while your body just gets used to coming back to normal, getting better. Okay. The other thing we should talk about is sex. When can you have sex again after this kind of procedure right in, your perineum? Can be worrying, particularly if you've had a severe tear. But once your stitches, once we're sure that the stitches have healed and bleeding has stopped, then it's possible to resume sexual activities with your partner. Okay. Of course, we recommend that before you start that, think about a suitable method of contraception, because it is possible to get pregnant pretty soon after birth and your body needs to rest. So it's good to have a thought about that. The other thing that will be useful in terms of healing that area is called perineal massage. I'll put a link in the description box, because if I go into all that, we're going to be here for quite some time. But perineal massage is something that can help in terms of improving the healing in that area, making it flexible and supple, and doing that before sexual intercourse might actually help you feel more comfortable. So it's something worth thinking about. Another point is that women who've had a baby, they might notice that the vagina is drier than usual, and this can sometimes cause bleeding after sex. But it's a feature in some women who are breastfeeding. So it might be useful just to think of using a lubricant the first few times that you have intercourse. or if you're using condoms, use a water-soluble gel, just to reduce the risk of developing any more trauma or any injury within the vagina. So the bottom line is that you can resume sex as soon as as the repair or the cuts or tears have healed. It can be a bit uncomfortable and feel a bit different at first, but the discomfort should not continue. And discussing how you feel with your partner and any anxieties that you have is recommended, instead of just keeping mute and suffering in silence. What will happen if you're thinking about having another baby? So any of these injuries or tears, when well repaired, things go pretty much back to normal. And many women do go on to have a straightforward vaginal birth, a vaginal birth again, even after sustaining a third or fourth degree, that is the severe tears. So in a very small group who may continue to have symptoms, they might want to consider having a planned cesarean section. So these are the things to think about. And another point I want to raise after about recovering from a tear is your mental health, your mental state. Some women can experience post-traumatic stress disorder from the experience, because having a third or fourth degree tear, it can be quite distressing and disturbing for women and their partners and their families, and can cause difficulty, particularly after the pressure of looking after little one, bonding with little one, trying to get used to their patterns of feed and all that can be quite challenging if you're also struggling with pain and discomfort of this experience. So some women may experience flashbacks into the labor. They might feel very anxious. You might find that they have low mood or feel very alone or isolated and struggle to bond with the baby. So PTSD, that's post-traumatic stress disorder, can develop either immediately after birth, or it can happen several weeks. You may think everything is fine, and suddenly the symptoms start. It could happen several weeks, months, or even years afterwards. So really important, if you do find yourself in that situation, to please seek medical attention. So let's switch now and talk about an episiotomy, because so far I've been talking about the tears. And remember, the tear is an injury that's sustained during the process of labor. So it's not planned. And there are certain factors that could increase its risk of happening. We've talked about a first-time mom going into labor, a vaginal delivery, baby who's quite large, and a large head circumference. But what about an episiotomy? Now, an episiotomy, or a cut, which is the other term that we use for it, you might hear people talking about a cut, is a surgical procedure that happens during the natural vaginal birth. It shouldn't be a routine. It shouldn't be a routine. The reason that you might get an episiotomy is to make the vaginal opening wider. And let's get our friend back. So, if labor is progressing and you're examined, your midwife or the doctor examines, and the baby is advancing, but they think by this baby's size, I'm struggling, it might be difficult that for this baby's head to come through this opening, that might be the time that they want to introduce a cut, just a small cut to make the opening wider and help the delivery. Now, it's not just as you will see in a couple of minutes, it's not just when the baby's head is big. There are other circumstances where it might be necessary to have the episiotomy, but it's when the problem is identified. And what we're trying to prevent is a tear. That's the thing. You give an episiotomy because you're trying to prevent a tear, and there could be some complications, because if the baby can't come through the canal because it's narrow, the opening is smaller than the baby's head, then the baby could be distressed. You don't want baby sitting in the canal for that long period of time. So there are medical reasons why it's important to conduct the episiotomy. Like I said, to make the opening wider. And ideally, you should have a numbing medication or anesthetic injected into the area where the cut is going to be administered. So that's a small injection, or unless you have epidural anesthesia, in which case you probably wouldn't. But a small injection into the area around where the cut is going to be given, that's the usual or standard procedure. So when would you usually have an episiotomy? I've mentioned one already, which is obvious, which is if the baby's head is larger than the vaginal opening. Now, it could be that the baby is coming through, the heads come through, but the shoulder, as the baby travels to the canal, as the shoulder is going to come through, that might be too big and doesn't fit into the birth canal. So what you're trying to do is create a bit of space for baby to come through. Now, a baby who is in distress, because we have monitors that look at how baby is getting on during the process of labor. So if your doctor or your midwife feel that you've been in labor and it's been taking some time, baby is not coming out either because the contractions are not strong enough or whatever reason, but they think baby is in distress and needs to be delivered soon, they could use an episiotomy just to help to widen the canal and help labor go through. Another reason is if baby is in a breech position. So the breech position meaning that the baby is not presenting with their head, presenting as in coming through the canal, the birth canal first with their head, but instead with their bottom. Now the head of the baby, like I said at the beginning, is a skull. So you have this skull, but not as hard as what we have, but at this stage, quite soft and flexible. So even as it passes through the confines of the birth canal that is muscular and that's stretchy, that head that is so flexible can manage to do that. But the bottom is firmer and may not move as flexibly or as easily as the head will. So that can create a problem. And if it is thought that the baby's head might get, the baby's bottom might get stuck and not be able to advance through the canal, that might be a reason to get the episiotomy. Other reasons are if mom is not able to push, if she's been in labor for several hours and she's struggling to push, she's tired, you might want to give a cut. Some women have serious heart conditions where you don't want them to put too much strain on the heart during their delivery, and you want to minimize any risk and help speed up delivery. So a little cut might be administered at that time as well. And I've mentioned about when vacuum method is used, this because we know that using the vacuum, there is a link between that and experiencing tears. So the doctor or your midwife might just be proactive and administer a cut in a controlled fashion to avoid the risk of developing a tear that could be quite extensive or going to a 3rd or 4th degree tear. And these are some of the reasons why you could have an episiotomy. Now, there are different ways that the surgical cut can be given, from the opening of the vagina in the middle towards the sides or back towards the anus. But as I've said, the aim is to widen the opening and allow the baby free crowning, prevent tearing when the baby is crowning. And it can be carried out by your midwife or doctor. And afterward, your cut will be stitched back together to allow healing and recovery. And generally, this can be done under local anesthetic in the labor room, and that's usually what tends to happen. Now, even though we've said it's an intentional cut and we've explained that it's done for good reasons, I've explained the different reasons why you might need to have it, there are problems that could develop after the episiotomy or the cut. Of course, the most obvious is the pain that you will get in that area. So pain as the wound heals, even when you're just minding your business, lying down, doing nothing, but also pain when you're passing urine or opening your bowels. And you might experience excessive bleeding from the area because, of course, as the introducing a cut into that area will cause bleeding. And when it's repaired, at least for the first few days, you might still, or the first few hours or days into the repair, you might still experience bleeding. Infection, again, is another complication similar to what happens when you sustain a tear. And the area might be swelling, the area might be swollen simply because these are the way the body reacts. This is the inflammatory process, and that's how your body reacts after sustaining that kind of injury. So those are the sort of local, straightforward ones that we expect to happen. But beyond that, there could be problems where, for example, if blood collects in the tissues, in the spaces in between the areas cut, and it's called a hematoma, that can cause a lump or collection of blood inside, deep under the tissues, and that can cause a lot of pain, could also get infected. So it's something that can delay the process of healing, makes the pain worse. And again, you could be left with scars or itching around the area from both the stitches, but with the scars that might develop after the episiotomy is repaired. Similar to what we have in COTS, you could have problems with sexual intercourse. Yes, the vaginal canal, like I said, is elastic, can stretch to accommodate the size of the baby's head. And usually it will return to its pre-delivery shape. But sometimes if you do have an episiotomy, and if it's not properly repaired, there could be a change to the structure of the canal. And that could affect sexual intercourse. So let's look at and talk about things that can promote healing after the cut. And some of them are similar to what we talked about with the tear. But it's really important, if you want to promote healing, heal faster after an episiotomy, keep the area clean. Okay, clean the area properly. Use clean cotton towels for wiping to prevent buildup of bacteria, reduce the chances of infection. Don't forget, please, to wipe from front to back, because you don't want to introduce any fecal matter or germs in particular from around the anal area to the front that can cause infection. And avoid rubbing the area. So it's just gentle dabbing. Avoid rubbing the area because that can cause irritation and inflammation. Please be sure to take your medicines on time. Okay, if you're on regular pain medicine, take them as recommended or as prescribed by your doctor. It's good to allow air to pass through the area after you've had a repair. That would help your wound heal quicker. So if you can, for some minutes or for moments during your day, be without your pads or without underclothing, of course, when you're on your own, then do so, just to allow some air to get to the area. Something that can help to relieve pain and, of course, promote your healing is using ice pack. So an ice pack, a clean towel that you wrap around a block of ice, or an ice pack, a small pack you can place above your sanitary pad and underwear, just to help to relieve the discomfort, because it can be quite uncomfortable. So that's something that you could consider in addition to your painkillers. So really important to use sanitary pads. This is not the time for using tampons or Tampax. The sanitary pads absorb the bleeding after delivery. And again, like I said, under the discussion about the tears, important to make sure you're changing them frequently so we reduce the chances of any infection. Also, you might take this for granted, but keep nails short. Sometimes you might be prescribed creams, analgesic, pain-killing creams, or numbing creams, and trying to apply those with long fingernails. One, you might cause damage. The nails might cause damage to those sensitive tissues, or might introduce infection. So trim the nails, and if you're going to apply cream to those areas. What else can you do to promote your healing after the episiotomy? You can do pelvic floor exercises. I've talked about the pelvic floor muscles, and doing the exercises help to strengthen those muscles and promote faster healing. So the pelvic floor is made of muscles in the space between your pelvic organs. So your organs on top, the womb, the bladder, the rectum on top, and the perineum, which is that sheet or that floor that contains the genitals and the anus. The pelvic floor is in between and consists of muscles. So like I said, you can feel your pelvic floor sitting there listening to me by doing that stop urination test. But please don't do the stop urination test frequently, because that can harm your bladder. It's just so that you know what I'm talking about. If you stop and hold your bladder, that can cause injury to your bladder if it's not something that you do on a regular basis. So please don't practice that. So pelvic floor exercises, if you want to strengthen them, sit comfortably and squeeze the muscles. Those muscles I've just described to you, I've just demonstrated or explained to you where you can find them. Sit in a comfortable place and squeeze the muscles 10 to 15 times if you're going to do pelvic floor exercises. Imagine, for example, you're sitting on a hard surface and you're trying to lift it up with those muscles, okay? When you squeeze, do so for about 3 seconds and then relax for a count of 3, okay? Try not to hold your breath, be relaxed. The muscles you're trying to squeeze are the ones in the pelvic floor, not your stomach muscles or your bottom or your thigh. So just to have that at the back of your mind, you're breathing and you're not tightening your tummy muscles or your bottom or your thighs. You're concentrating on those muscles within the pelvic floor. So you can do your 10 to 15, squeeze the muscles 10 to 15 times. You can add more squeezes as the weeks progress, but just be careful not to overdo it. This is something that you could have physiotherapy for. and a physiotherapist can demonstrate to you. There are also lots of good reading aids or video aids that you can watch to learn more about how the pelvic floor exercises work. But after a few months, you should start to notice results that your floor is strengthened. And it's also recommended, even if a woman has not had a tear or cut, in terms of helping to improve things after having these, after childbirth. Another way to promote healing after the episiotomy is to use a Sitz bath. Sitz bath, that's of German origins, an excellent way of healing the perineum, and you can use it at home. You don't even need a doctor's prescription. So a Sitz bath is what you have when you soak in gently warm water, and it can help to speed up the healing process by boosting blood flow to the area. Now, it's not going to cure the cut or the tear, but it helps to soothe irritation, and it might provide some relief from the soreness or burning around the area, in addition to the other things that you'll use. And it can even be used for children who have constipation, or men who have infection of the prostate gland, because this is where the problem is, those areas down below where you're sitting on. So using a Sitz bath can be recommended for such purposes. How do you put together your Sitz bath? So you run a small amount of water in your bath. So you fill the bathtub with about 2 to 3 inches of warm water. Don't add shower gel or bubble bath or any type of soap. So none of these material that could contain irritants. Okay. Some people add salt. Some people add the name of the other thing skips my head now. If I remember it, I'll say. But don't add any of the shower gel or bubble bath. Okay. Now, when you've made up the bath, and don't forget it's nice warm water. It's not hot, please. It's just gentle warm water. You can soak up to 3 times a day, and that's for 10 to 15 minutes. And sometimes you might need to do it more often just to get some relief. That's fine. So sit there, making sure it covers your private area. And afterward, just gently pat the area. Don't rub vigorously, just pat your genital area. And some people suggest using a hairdryer on the cool setting, but I think just go with a towel, a clean towel, and just gently pad the area. do what you have. Do what you have available to you. Okay. So I think I've talked about tampons. Yes, I have. Don't use tampons, please, for up to 6 weeks after delivery. So key thing about these tears and cuts is pain control, pain relief. As I've said, you'll be prescribed some pain medicine. If you're not, please ask for something for pain, but take it as recommended. I've talked about using ice packs and avoiding long meals that could inadvertently just cause more problems. And when you're moving about, just be careful, move gently, try not to exert any force on the vaginal area when you're sitting or standing. Okay, so just be careful. Those movements, don't do things, don't jerk up or jump up. Just be careful, just so that it doesn't cause or put any pressure on your healing wound. Use cushions when you're sitting. Avoid sitting on hard surfaces. We've talked about this before, about preventing constipation. Take laxatives, and we do offer laxatives to women who might be experiencing, who have had their cuts, or had tears, to make sure that they avoid getting constipated. So straining doesn't put any pressure on the wound, and straining could even damage the stitches, losing the stitches before they've actually had the time, before the muscles and the tissues have had the time to come back together. We've talked about what you do when passing urine, the same as what you do with the cut. Use a bottle containing warm water while you're passing urine. And again, I think I've said it like thrice now. Don't rub and wipe as you're wiping the area. Pat it dry. It is important to avoid sex while your wound is healing. We've talked about healing could take anything up to 4 to 6 weeks. It's important because it will be painful and sore, but you need to give those tissues down below time to come back together. The stitches are helping to keep them together, but what you need is those tissues themselves to heal and come back together. And if you're having sexual intercourse before that has completely happened, that could put pressure, increase pain, and could lead to the stitches breaking down. So there are creams and numbing sprays that are available, as well as painkiller medicines that your doctor could prescribe for you. And this is the last bit I want us to talk about. And I'm sorry it's gone on so long, but there's so much to cover in this. And I probably have just maybe touched the tip of the iceberg. And of course, if you have a question, please feel free to send us an email, info@askawayhealth.org. I've got a question from David. Thank you so much for writing and saying, so is it that the vaginal tear is then due to poor management of delivery? Well, in some instances, that is possible. And what's advocated at the moment is controlled pushing. When the contractions come, then you encourage the mother to push. So it is possible that if the delivery is not well managed and whoever is directing or assisting the mom is not taking advantage of the times when the contraction is heaviest to encourage mom to push, it is possible that such not using techniques like controlled pushing could contribute to developing tears. So that is a factor. It's not the only one. So I wouldn't say that alone, but it is important that when a woman is in labor, she's supported and guided. And that's generally what you have. But there are some instances where things don't go to plan. And so what the woman might experience is inadvertently pushing before it's right, and either the baby comes through very quickly and that leads to a tear, or it's not the right time to push and that contributes to a tear as well. So those things can contribute. So that factor can contribute, but I would not center on that alone as being responsible. But thank you for that point and question, David. I think that's quite relevant. So yeah, so we're going to round up in a few moments. Can you prevent a tear and episiotomy? And that relates to the question that I've just been talking about, that yes, in terms of managing the process of labor, it is important your midwife or doctor is telling you when you're fully dilated, and therefore you can start pushing, because if you try to do so before your cervix is fully dilated, you can cause injury there. And if you push without waiting for the baby's head and its body to come into alignment within the canal, because as baby is moving, your contraction or your pushing or activity could impede or assist. So it's important that the process is supported and controlled, and which is what your midwife and doctor would support you doing. But there are other things that you could do to help to prevent the possibility of developing. I've said, if you remember at the beginning, that it could happen because of using the vacuum, which that's usually not something that's planned. It's something that you might think, okay, this might become necessary, so you have it ready, and then it's in labor or during childbirth that you decide, okay, I think we need to use the vacuum or the forceps, as the case may be. Or the size of the baby's head is what it is. So we know sometimes they are unavoidable, but what can you do while you're pregnant, getting ready for your childbirth? Eating and drinking well. A balanced diet promotes the health of your tissues down there, making them more elastic and supple and able to stretch properly, and obviously quickly heal better if you do get caught or sustain a tear. So we're talking about eating foods that are rich in protein. Recommend vitamin E, omega-3 and omega-6 fatty acids in your diet as being helpful. Doing or practicing pelvic floor exercises when you're pregnant can also help to increase the flexibility of your perineum. And I've demonstrated, or I've described how it could happen. I will put a link that would send you. I'll put a link for some of these really good aids or channels where you can watch and just see how it works. Just don't overdo it, please, particularly while you're pregnant. The other thing is the perineal massage, at least 6 weeks before your delivery date, to make sure it's also flexible. And I'll put a link for that in the description. And as I've just said, controlled pushing during labor can prevent the need for an episiotomy and reduce the risk of having a tear. Controlled pushing. Other suggestions are avoiding the back or supine position while pushing. It's thought that the lateral, that's when you're lying on your side or even sitting up, or the upright birthing positions help to reduce the need for an episiotomy. So there's some observation about the position during childbirth. And another thing that's quite useful is taking childbirth classes to learn the different techniques, preparing yourself, and learning these positions that can help to reduce the chances of having an episiotomy or a cut. So it's important to remember, after a cut or a tear, the discomfort can last for a few weeks, but it is temporary. And this is what I really wanted to emphasize, that yes, there's a whole big hoo-ha about how it happens and the risks and so on. I mean, I've spent over half an hour trying to get through it quite as quickly as I can, but it is temporary. And once the stitches have dissolved, things will go back to normal, and in majority of cases. And following the tips I've mentioned above can help the wound heal faster. For some women, a small number of women who do struggle with this, it's really important to emphasize, please seek medical advice quickly so that any repairs or any or solving any complications can be done as quickly as possible. Okay, so I have covered everything I wanted to cover on the topic today, and I'm so glad that you guys were able to join me. Thank you for the question. Thank you so much for the comment. I think the series is one that I'm really interested in continuing. I hope it's answered some of the questions, either if you're expecting or if you've had or if you have had an episiotomy or sustained a tear. I hope the points I've made sort of resonate. It'll be great if you wanted to share your experience once the chat is over. Lots of people do watch and find this useful. So please drop a line there. Don't forget to come back and like the video if you found it helpful. Share with a friend as well. Subscribe if you've not done so already to the channel. It's great really to have the support that you provided for us. Really, really fantastic. So guys, thank you so much for spending some of your Sunday afternoon with me. Next week, we're going to continue with another aspect of pregnancy stories. So make sure you look out for the notification, click the bell for after subscribing to the channel if you want to be notified every time I publish a new video. Keep your eye on the lookout for the next topic we're going to be covering. And if there's any that you think really we should put a spotlight on, feel free to drop it in the comments and to send, or you can send an email, or you can send a message on Twitter or Instagram, whichever. Hello, Dr. New Wine Platter. Hi, Helen. Thank you so much. Nice to have you around. David says, thank you. It's an important subject for which many women have bad experiences. Absolutely. So one of the things that we can do is provide as much information, answer questions, encourage our women and their partners as well to ask the questions and prepare as much as possible if it happens. Provide the best treatment that we can, provide the support, recognizing that it can affect both physical and mental health. So that would be so useful. And share to my pregnant folks. That's great. Thank you so much from New Wine Platter. All right, guys, I'm going to shut the stream now. Thank you so much for your time. I hope the rest of your Sunday goes marvelously well. I hope your week goes excellently well as well. Anyway, you know what I mean. Have a great time and stay safe.